co-founders, or can I get your titles?
We're both directors of Intaction.
Directors of Intaction, so Anthony Losquadro.
Anthony Losquadro, I'm the Duke of Foreskin, and this is my associate, David Grant. He's the Prince of Pubis.
These are amazing. This is amazing. You guys are awesome directors. I can tell. I love the merch you guys are wearing right now. You guys came to the interview with the merch on, and people can't, well, if you see it over on your YouTube channel, they'll be able to see the merchandise. Could you guys say where your YouTube channel is and stuff?
Well, our YouTube channel is Intaction 1, and you know, if you want to be for foreskin, you've got to breathe it, you've got to live it, you've got to believe in it. There's nothing to be embarrassed about. It's a natural body part. My T-shirt says Foreskin XL because foreskin is extra large in benefits and advantages, and you know, it's a natural body part. It's authentic and it's untamed. And
sweet deal. I have here my Foreskin is Fun Skin shirt on. I mean, hey, that says it all, because it really is. It's about making sex fun. It gives you so much more options when it comes to sexuality and enjoyment. The sensation is so much better, and it just allows you to go as far as you can sexually, and you're kind of held back when you only have you know, what's left of your penis. So we want to promote having it all.
For sure. Yeah, I would like to say that the reason that I came across Intaction is that I was walking through Union Square with a buddy of mine, and we heard a baby crying. And this wasn't that abnormal, but it was a baby screaming at the top of its lungs, screaming. So then we looked over, and there was like an exhibit right there, and it was something from Intaction. Could you guys describe what that exhibit was, if you know what I'm talking about?
Yeah, well, you saw one of our most popular exhibits that's the infant genital cutting exhibit, and it's a 3D diorama. It's interactive, and it's exactly what happens to 1 million baby boys every year in America. The equipment in our exhibit is the actual equipment that a doctor would use in a hospital. It's identical, and it shows a baby strapped down, spread eagle in this contraption, and they're putting a crushing device on his penis, which crushes the foreskin, which doctors need to do to start blood coagulation under the skin, so they can then crush and remove the foreskin. And that's what the process is. If people think that their baby slept through it, or the nurse came out and lied and said, well, your baby didn't feel a thing, this is really a bucket of cold water on those myths and misconceptions. It's painful. The baby feels every bit of it, and when you see our exhibit, there's no dispute on that point.
And people, amazingly, like, people will say, like, that's what happens? Like, they actually strapped them down?
Yeah.
It's like, yeah, you have to hold the baby down because they're screaming bloody hell, and they're going through, like, the greatest pain of their life. In many situations, that really is the greatest pain you'll ever know, and it's at a point in your life when you should not be going through such a thing, because your brain is still forming, and all these important factors. So yeah, but people are really surprised that this is what happens, that the baby really feels this incredible pain, and they're screaming. And so it's important to do that, but as you see, the rest of our displays are very foreskin positive, sex positive, and that's really the one thing that we is kind of shocking and harsh.
Yeah, for sure. When I walked past it during that time, it was a time when it was in the news a lot about the migrant children in cages. So as we heard it, we thought it was going to be something about that. And then as we walked closer to it, it was about circumcision. And we were like, whoa, this is definitely not what we thought, when you hear crying children. But it is true. It's like, most people don't think about it because they're not in the room when this is happening. And it's just happened for so long. Can you tell me more about Intaction and what exactly Intaction even means?
Well, Intaction is just conjugation between intact and taking action. We're a group of people that feel like circumcision and genital cutting should not be done to children, boys or girls. And we started Intaction to give babies a voice and to spread our educational advocacy to make people aware about what's being done to 1 million baby boys every year. And you know, we've got this whole entire Goliath medical industry that profits of over $1 billion a year are made from circumcision of children. That ranges everything from doctors' fees, hospitals' fees, the equipment, and even selling the baby infant foreskin tissue to biotech companies. There's a whole downstream industry that feeds off of foreskin tissue taken from babies. It's a $1 billion business, and you know, against that is just the Davids like of ourselves and a few other activist organizations, which people. They're just groups of people that believe this practice should end, and it's just us against them. And we felt that, you know, we founded Intaction because we felt that we needed a little more firepower in this movement, in this cause, to try to protect American children, because this is a unique American phenomenon.
Yeah.
People have to understand, outside of the religious communities, which are small, whether it's the Muslim community or the Jewish faith, outside of that, this is an American phenomenon. 90% of the world doesn't do this.
Yeah, I'm Hispanic, and I've never, like, my family didn't do that, and if they did, it's once they started coming to America and, like, you know, living more of their lives here than they did in Dominican Republic. But I've never, like, in Latin America, I've never seen that as, like, a common practice.
Yeah, you won't see it in Latin America, you won't see it in Central America, you won't see it in South America, you won't see it anywhere in Europe, you won't see it for the most part in Asia. Japan, there are a few pockets around the world that do circumcision, but for the most part it's a unique American phenomena, and Americans that have so much tunnel vision on this issue, and they think everybody does it all around the world, and they couldn't be farther from the truth on that.
Is this an issue that is partisan or bipartisan? Like, do you find that, you know, it's anybody that cares about this is not just from one particular demographic, or do you find that there are certain demographics that are a little bit more hesitant to what you guys are saying?
I haven't found it to be like a political issue, but it's a geographic issue, and it's an age issue. So, for instance, like on the west coast of America, California, Oregon, Washington State, those states will be very low in circumcision rates, maybe down around 30%. Then on the East Coast, like especially like metropolitan areas like New York City, where there's a lot of immigration. I mean, New York City is really an international city. Yeah. It's pretty low. But when you get into the Midwest areas or the suburban areas, the rates go much higher, maybe as much as 70%. So according to government statistics, the rate is around 56%, and it's declining in the last data that we have. So it's a geographic issue. It's also an age issue, where younger people under 40 or more are opposed to it, and people over 40 or 50, 60, they've either are circumcised themselves or they've circumcised their children, and they're invested in the decision, and they're less likely to move off of that. But younger people, millennials, they're more against it. They see this for what it is. It's just non-consensual abuse and genital cutting of children.
I was going to ask, so circumcision is usually a word associated with boys, but can circumcision also be referred to for female mutilation of genitalia?
It can be. Other parts of the world. Yeah, the word circumcision is a euphemism. Okay, and euphemism is a word that's invented to really cover up or disguise what's actually going on. So what we're really doing is cutting genitals. That's what it is. So they come up with the word circumcision because it sounds more noble. But circumcision can be applied to females, and in that case, the advocates of the people against that movement against female genital, they've called it mutilation, female genital mutilation. So, people in Africa, the Mideast, they call it circumcision, and they call us hypocrites because we're against female genital mutilation, but yet we cut our boys. Yeah.
And don't say anything about it.
Yeah, but we're criticizing them for cutting their girls. Yeah. So they see this as just a big American, Western, imperialistic hypocrisy.
Yeah, I mean, do you think that more people would be in an uproar if it was like the word was more associated with girls, and like if people knew that, you know, circumcision is exactly that, it's mutilation of male genitalia? Do you think that more people would be they would care more about the issue? Like, what is preventing people from really getting behind this?
Well, there's a lot of people actually in the FGM movement that try very hard to separate it from male circumcision. They try very hard to make sure that you don't associate the two things. When in fact, with FGM, most of it that is actually performed is less invasive than male circumcision. The most common form of female circumcision is a little cut, a little pinprick to the clitoral hood, and to make one drop of blood. That's to signify, a cleansing and whatnot. And then other times they remove just the clitoral hood, which is the female equivalent of male foreskin. So that is the same thing. There's very small percentage of FGM that is performed, which the FGM people say that, well, this is what happens all the time, but it's really only about 5% of FGM where they actually really scrape away the whole clitoris and part of the vulva and whatnot. So that's actually a very small percentage that's done in a certain part of Africa, and a lot of Muslim circumcision is really less invasive and takes away less tissue than male circumcision does.
You brought something up that I'm going to save because I have a question further down the line, but first I wanted to ask about the mental and physical implications later on in a person's life that gets circumcised. Could you speak about that?
Sure. There's the emotional harm and the psychological impact of genital cutting done to baby boys. Now, people are under the belief, or some people that are trying to, defend their decision to cut their sons. They say, well, he didn't remember it. Because he didn't remember it being done, it didn't harm him. And what people have to understand is just because a child doesn't remember something, that doesn't mean he's not affected by it. The pain and trauma, you have to understand that babies can't be given anesthesia like an adult.
What about, I read something about like topical stuff that they will rub on it, so it's not anesthesia, but it's something as a pain relief.
There's a cream called an Emla cream that they could put on, and let me tell you something. If I put some Emla cream on your arm and I stuck you with a needle, you'd hit the ceiling. It's very ineffective. As a matter of fact, in the package insert on Emla cream, it specifically says don't use it on infants, so go figure that one, why they're using it on babies. But the cream is ineffective. They can't really use effective anesthesia on a baby.
Yeah, because it happens within the first 2 days, correct?
Yeah, it's happened, before the baby leaves the hospital with the mother. And they can maybe give lidocaine shots. Some doctors don't want to be bothered with it because it takes more time, and or they don't know how to administer it. A lot of doctors don't know how to administer lidocaine shots. You have to understand, it's not like they go to medical school to do circumcision. Okay, there's no courses in medical school on doing a circumcision. How they learn doing circumcision is the old adage in the medical business: see one, do one, teach one. So when they're a resident, another resident or another will show them how they do it, then they do one, and then they teach somebody else. That's the summary of their training on infant circumcision. So whether they can do, whether they have the knowledge to administer anesthesia, most likely not. And I know this from speaking to nurses in hospitals that confide in me. So you've got all this pain and trauma that an infant's being subjected to. So what's going on while this is happening? Their brain is dumping not their brain, but their adrenal is dumping cortisol, which is a stress hormone, into their blood because they're strapped down, their genitals are being crushed, they're in a lot of pain, and it affects the cortisol and all the pain. All these neural connections are being made in what they call the limbic brain, which is the amygdala and the hippocampus. And these are parts of the early brain that are used for decision-making and emotional control. And all this pain and trauma is impacting how these connections are being made early in life. So this causes PTSD, which is post-traumatic stress disorder. Studies have found from the University of Sheffield that Babies that are subjected to circumcision have higher rates of SIDS, which is sudden infant death syndrome. And then later on in life, it's been found that the circumcision trauma causes emotional changes in the person later on in life. And this is documented in studies and in research.
So my question is, with medicine evolving over time and, you know, surgical procedures evolving over time, how come this is something that they clearly haven't just improved and they still use, I read, like these big clamps, and a lot of it is just guesswork with the cutting? Why hasn't this improved as a procedure?
I don't know that there's really any improvement that can be made. You need to somehow, you need to tear the foreskin off the head of the penis, or the glans penis. That needs to be torn off because it's adhered like a fingernail to the nail bed. So that needs to be torn off. They need to make an initial dorsal cut, which is cut along the top to insert a device. There's different types of devices. There's a Mogen clamp, there's a Gomco clamp, and there's a Plastabel. They all serve as means to stop the bleeding, because if you cut the foreskin off without that, the baby would likely bleed to death. So they have to do something to crush the foreskin. It's like getting your finger caught in a car door and slamming it shut. Except we're going to keep the car door shut until the bleeding stops. That's how circumcision is done. And there's no way to improve this. This is the process. And unless the human body changes, there's no way to change the process. And incidentally, one of those devices I mentioned, the Mogen clamp, the original Mogen company's been put out of business for malpractice claims because it's very possible that the head of the penis becomes entrapped in the clamp. You have to understand a baby is very tiny, so when they put this device on the baby's penis, if the tip of the penis or the head of the penis is caught in the clamp, it's very hard to verify if it's safe or not safe, and they shut that clamp shut, they can crush the head of the penis and basically have chopped meat after that. Many babies have lost their penis. There's 2 cases on Long Island right now. Northwell Hospital, same doctor, destroyed 2 babies' penises in a row. Cases in Nassau District Court, and one is in Suffolk. And the hospital still used the Mogen clamp.
Wow.
And the doctor is still working there, so you could be bringing your baby to this man, and I think his name is Dr. Ira something, but you could be bringing your baby to this man, and you will not even know it.
Do doctors get paid more when they do the circumcision versus when a parent says don't do the circumcision?
Sure, we have a fee-for-service medical system. The more the doctor does, the more he gets paid. The more the hospital gets paid. Okay? So the doctor will get a couple $100s for doing the circumcision, and the hospital can bill like $1,000 or so as a facility fee, because you're using their facility, you're using their bed, you're using their equipment. So the hospital, this all gets billed out to insurance or Medicaid. I can give you an example. I know someone in the medical business. I'm not going to say their name because
that's okay.
And they work on a hospital in Long Island, and they had to do something to a patient. They had to add an extra stitch because they were bleeding, and so they did that. No big deal. Patient is fine. And then the billing department comes to the floor and says, "Why didn't you take that patient's blood pressure and temperature?" She says, well, the person said, well, I didn't need to do that. All I was doing was putting in an extra stitch. Because the billing department monitors what's going on to make sure everything possible gets billed out. The billing person says, you don't understand. If you don't do it, we can't bill it. So they push unnecessary procedures in order to increase their billings, because hospitals need money, as much money flowing into them as possible. And whether that's beneficial to the patient or not is another question sometimes.
Does the doctor come out and ask, do you want your child circumcised, or is the default assumption circumcise it, and the parent has to come and say, don't circumcise them?
I had two children born at Northwell Hospital, LIJ, okay, within the last few years. In both instances, they came out and repeatedly asked us, are we going to circumcise? Are we going to circumcise? Do you want to do a circumcision? I just need to put it in the computer. I want to ask you. So if you put it in the computer one time, why are you asking me 2 more times afterwards? And we had to repeatedly tell them we're not doing a circumcision. One was a girl, so that was kind of a moot point. But they kept asking us up because we didn't know the sex. They kept asking us up until the birth. So And then when my son was born, the obstetrician came into the room afterwards and said, "Are we doing a circumcision?" And I had to tell him no again. So they pushed the parents, to do it by constantly asking them.
Mm-hmm. There's an outpatient to-do board in many hospitals, and we see them on Facebook. People have taken pictures of them, and where you do go through this, where the nurses, the doctors, they're supposed to go through this whole list of things to do before the baby gets actually released, and circumcision is one of them. It says circumcision, so it's kind of like push them to do it, and the nurses are trained to go and ask you, and they'll have another nurse ask you, and then they'll have a doctor ask you. So it's this little strategy that they have that eventually they'll wear you down,
and you'll be like, do it.
And one person will be able to convince you a little more than the other person will. They'll find out what you're kind of vulnerable on, and work that edge in order to get you to have it performed.
Yeah. We've had people tell us, they use different techniques, well, if you don't do it now, if you do it later, you'll have to pay for it out of pocket, or the doctor's got to go. Can you make up your mind now? If you want to get it done, let's get it done. Yeah. So they use all these kind of high pressure sales techniques, like selling a used car, to get parents to waffle and give up and sign the consent form.
I wanted to ask you both about some of the things that are said on the internet to see whether they're true or not. I was doing some research, and it seems like this is something where even on, sites like the American Academy of Pediatrics, you'll find confusing information on there. So one thing that I read is, some of the pros about this are that it reduces penile cancer in men, syphilis, gonorrhea, HIV. What can you guys say about that?
Well, as far as penile cancer, that's about 1 in 100,000 will get penile cancer. That is also, and the average age is like 70-something when it happens, and it's considered a very rare cancer to begin with, and it is treatable, when caught early. Now, breast cancer happens to 1 in 8 women, and we don't tell people, well, you should have your girl's breasts, taken out, cut off early on in life to prevent breast cancer. And breast cancer is a deadly thing. So many of the women that have breast cancer will actually die of it. Now, there's also vulva cancer, which is actually much more common than penile cancer. So vulvar cancer, if you cut away the parts of the vulva, then you actually will be saving them a higher chance of having that vulvar cancer. So, but it's a rare thing, and penile cancer is even more rare than that. So, it actually makes more sense on the books, actually, if you're going to be using preventive medicine to circumcise girls than boys. And also girls throughout their life, to the day they die, they have infections, various yeast infections and all of this, but for various reasons. So, but we don't cut off their skin in order to, say, well, there's less places for bacteria to hide, there's a less chance of yeast to grow, and all of this. And so all of these reasons, even pro-circumcision doctors are just saying, okay, the medical benefits, if you believe them, they're very small. They're very small. They're not enough reason to actually have circumcision. It's more cultural reasons. And so even the American Academy of Pediatrics are backtracking and saying that the medical reasons really aren't enough. There's not, just simple hygiene, whatever, will take care of the penis.
It's
So.
interesting. So, like, a place that I went to that I saw was the Johns Hopkins Medicine website, and on there they say that the general agreement among healthcare providers is that the benefits do outweigh the risks, but then they also go on to say things like circumcision is relatively simple and it has few complications. So that's why a lot of the information out there is really confusing because, you know, when I think of Johns Hopkins, I think it's a credible place, and then I see this on their website.
You got to realize there's over 20 medical associations around the world that specifically do not recommend circumcision. These are European, even Canadian Pediatric Society does not recommend infant circumcision, citing lack of health benefits. 16 states have dropped Medicaid coverage for infant circumcision, citing lack of health benefits and deeming it a cosmetic surgery. In terms of penile cancer, the American Academy of Pediatrics on page 14 of their technical report say that 322,000 infant circumcisions would be required to prevent one penile cancer event. And in the process, it'd be 644 severe complications from the circumcision. So penile cancer is very rare. European men, where they're, like I said, they're 95% intact over there. They have lower rates of all STDs, lower rates of HIV, and no higher penile cancer events than we have here in America, where most of the men tend to be circumcised.
Another one that I read often is there's less chance of HPV and cervical cancer in women. What about this? Is this...
Again, that's another myth, you know. The American Academy of Pediatrics looked at that, and on page 13 of their technical report, they said that the studies were conflicting, and what they said is that in terms of cervical cancer, the contribution of male circumcision to the prevention of cervical cancer is likely to be small. As the Gardasil HPV vaccine becomes more widely adopted, that issue becomes less and less relevant. But you have to understand, you can get HPV a lot of places on your body. You can get it in your mouth, your throat. It could be on your genitals. It could be in your rectum. Foreskin doesn't spread HPV any more than any other body part does.
I also noticed that they like to tout these studies from like African countries, and like one that I saw was that they did this one in Uganda where 40 out of 137 men that were with a partner that was HIV positive, if they were uncircumcised, they got HIV. 0 of the men that were circumcised did not get HIV. So I see these studies, and they like to tout them from like African countries. But then, you know, a little side note that they'll include at the bottom is like, if you, in Western countries where hygiene is more blah, 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 blah. So they always like to tout these, like, you know, third world countries when it comes to this. Why is that?
The African studies are so biased and so flawed. If anyone looked at it with an unbiased eye, it's laughable. They did these studies. They did one in Uganda, one in Kenya, and one in South Africa. Orange Farm, South Africa, Kisumu, Kenya, and Rakai, Uganda. And all 3 studies, they took first of all, they took a group of men and they circumcised them, saying that, well, we think this is going to prevent HIV. Now, what are they going to do after the study if the circumcised men contracted HIV? So, sorry, we made a mistake. You know, of course, they knew what the result was going to be before they even started. And they took the group of men. The men that were intact, they said, okay, go back to your village and, you know, practice safe sex, whatever that is. And then they took the circumcised men that were going to be in that group, and they circumcised them. Now, if you have surgery, you can't have sex for a month or 2. Okay? So then what they did is they stopped the study early. So the circumcised men were already less exposed, they had less sexual experiences than the intact men. Why didn't they let the study go to the full term? Okay? And then also, they press release, it was a 60% reduction. Isn't that amazing? Right? That sounds big, 60%, right?
Sounds very big.
Okay, great for a headline. What's the actual? The actual was from 2% to 1.2%. And they call that a 60% reduction. Okay?
It all depends on the context of it.
Now, I say, don't give me percentages, give me actual. So, if there's 1,500 men in the study, when you distill that down, is only like maybe 15 men, one way or the other, could swing that result from 2% to 1%. It's only 15 men. Okay, the study didn't take into account if anybody was gay or homosexual, because no one will admit to that.
Drug users.
Or if there's other means of transmission other than heterosexual contact. Could be drug use, could be using a dirty tribal instrument or something. So just a small amount. So they're making a tremendous claim based on a very small, almost statistically insignificant amount of people that they say were now HIV negative because they were circumcised.
But it makes good headlines for them.
It makes good headlines. And why do they want that? Because these researchers and their institutions, of which Johns Hopkins University is one of them, got millions and millions of dollars from the U.S. government and from like the Bill Gates Foundation to go out there and do something. So they went out and they did a study and say, hey, we proved something. And now these researchers get tenure and they get all kinds of money coming in. These professors are pulling down probably, $1 million salaries at Johns Hopkins. And they're treated like they were heroes because of 15 men in their study out of 1,500 they said had a lower HIV rate because they were circumcised.
So what about things like balanitis, which is more common in men that are intact? I saw that there was more than 200,000 cases per year in the United States of balanitis, which is, for anybody that doesn't know, inflammation of the foreskin and the head penis.
Yeah, these are, look, the foreskin, like any body part, can need a little TLC once in a while, okay? So balanitis or BXO, I think the cause of that is a little bit unknown, but it's an inflammatory disease. Just like any skin on your body can have some type of thing, inflammation, or needs treatment. There are ways to treat it, I suppose as an adult, if a person had really bad, recurrent skin condition that just medication and ointments wouldn't resolve and better hygiene, I suppose then they could make the choice as an adult to be circumcised, to rid themselves of that, but that's a very small amount of intact men have that problem. Yeah. Just like a very small amount of people will have tonsillitis. Or,
So, I wanted to say, I actually know somebody that did get balanitis. They're an intact person. And it's what you said. It wasn't reoccurring. It was a one-time thing, but it was because they had never learned how to properly clean themselves there. Something that when I was going through school, when they were teaching health, the penises that you saw were circumcised penises on the diagrams or whatever it was, and it was never even a thing to teach boys how do you clean down there, because I guess it was just automatically assumed that everybody here was circumcised. So what do we do about education wise, and is there anything that Intaction is doing to try and educate kids more about it?
Well, it really is the simplest thing in the world. It's so much easier than brushing your teeth. Anything else, you just pull the foreskin back and wash it with warm water. You don't even need soap because soap, on a mucosal tissue isn't the best thing in the world. So it's very easy to do, and in fact, that can irritate and cause issues to come up, but yeah, it really is so much easier than cleaning a vagina. Just pull the skin back, clean it, and then put the skin back in its position. And so I mean, it's as simple as it can get. But
a lot of young boys never learn it, and then let's say a young boy with a single mother who might not know about that and might not think to even teach her son about that. He might just go his whole life not cleaning it, and then eventually, things like to grow in damp and moist places. So,
but that'll happen, and he'll find out then.
Yeah,
it's not like it's going to fall off, from that happening. So, when that initial thing happens, the doctor will say to him, hopefully,
he's going to freak out first, though, because the symptoms that I saw, they were very similar to what an STD symptom would be like. Discharge of the penis, like he's gonna freak out a little bit first.
Right. We do have pamphlets that teach, how to care for an intact penis, which is like super simple, 1, 2, 3 type thing. So we do educate people about that,
which is amazing. That is very, very needed.
We Intaction does play the role sometimes. Intact guys that come to us with an issue, we will play the role as patient advocate. And we will try to help them find a doctor that's knowledgeable on proper treatment of the foreskin, because if they go to just some ordinary urologist, they're only trained to do one thing, and that's do a circumcision, cut it off. That's the only thing they're trained to do. So And you know what? That solves the problem, but it leaves you without your foreskin also. So we will, you know, if any intact guys out there are having any issues, it could be whether it's a skin tear or BXO or some other issue, you know, we'll try to find you a foreskin-friendly doctor that can treat you the way a European doctor would treat a European patient, with knowledge of how to treat a skin condition, which are relatively uncommon.
I was going to ask about phimosis, which is the inability to retract the foreskin, and that circumcision could be recommended to them if it does become like an ongoing problem.
Well, the American urologist will recommend circumcision right away for that, because insurance will pay for it. They get $3,000 easily for doing that, an adult circumcision. It still only takes like 20 minutes for them to do. It costs them nothing, and it's really quick, and it costs the patient nothing either, because insurance will pay for it, because that is a billable condition. Now, what they can really do is do a steroid cream, which they use for a couple of weeks, and they just apply it to the tip of the foreskin and do some stretching on it, and it allows the foreskin, you know, in the process of like 2 weeks to become completely retractable. It becomes retractable to the point that you want it. You know, you might not want it too loose, because the you know, having it a certain degree tight is going to have a much better sexual feel to it than if it's loose and just, you know, flopping around. So so there are much better ways to solve phimosis that will make the person so much happier with it too. But a person with phimosis is a very easy target for a doctor, because not only of the money, but since you're having pain with your foreskin, and your only knowledge of your foreskin is that it causes you pain, so you're thinking it's a negative thing. Once they take that away, you're like, oh my goodness, you know, why, you know, we should do this to all boys. You know, we should just do this to boys, because, you know, this is a terrible thing that I went through, and we could save everyone by just doing this simple thing. But you know, if they are treated in another way that preserves the foreskin, they learn to actually enjoy the sensation of their foreskin, and are like, thank God I didn't do that, you know, because you know, and they don't even tell you a lot of times that you'll have to use lubrication to masturbate. You know, things are going to be very different than they were. So a lot of people that have had adult circumcisions really regret it. Really regret it.
Yeah, as we were saying, like, phimosis is a tight foreskin that won't retract, and that could be caused by a scar tissue buildup. And as David mentioned, that there are ways to treat that. You know, and circumcision should be a last resort. Not the first resort.
And another thing with phimosis is we're beginning to know, as time goes by, that it's actually over cleaning of babies that is causing the phimosis, because the foreskin is not meant to be pulled back until it is ready to be. And sometimes that's at 2 years old, sometimes that's at 5, sometimes it's at 9, and even into teenage years, as far as being fully retractable. So what doctors do is they tell you right away with your baby that you're supposed to pull the foreskin back to clean it, and that actually causes scar tissue. It causes damage, causes tears, and the doctor's like, oh well, we're going to have to do a circumcision now. You know,
it's crazy. Like, and people don't really understand that there's so much money behind this, so they just go along with it. It's so I heard in an interview, Anthony, that you had actually went to find the doctor that circumcised you. Can you tell me about that experience?
Sure. So before I got involved so much with activism, you know, I always wondered about the scar on my body and who did it and why they did it. And so I kind of started a journey of finding the doctor, the obstetrician that did it to me. And you know, I was deeply disturbed about what was done to me, and somehow speaking to that, if I could find that person, it would somehow help me get past it and give me some closure. So I did eventually find the doctor who did the circumcision on me, and he remembered me and my family. And, you know, we had kind of a conversation on the phone. He wasn't very cooperative, but he was listening to my questions. And maybe he was surprised as maybe one of the first patients that ever came back. Because, you know, a funny thing doctors say is nobody ever complains. Well, here's a person that complains.
Yeah, I'm sure he was not prepared for that.
So, from our conversation that we had, you know, I wanted to know why he did it, why was this done, and the gist of it all and the conclusion I came to was that he didn't have any reasons, he didn't have any answers. And to me that kind of summed up what circumcision was all about. It was something that's done to babies for no good reason. Mm-hmm. And that's what I learned from that experience.
Did you ever confront your parents about it and say, why did you let this happen?
Yeah, we've had some very good discussions about it. Mm-hmm. And, you know, I was born at a time, you know, I was born in the 60s, and there was no internet, and there was no access to information, and parents are lay people, and they rely on their doctors for information and guidance. And, you know, back at that time, basically, you know, circumcision rates were probably like around 90%. And so, you know, my fate was pretty much sealed. Mm-hmm. And so they just kind of went along with it. And, you know, they apologized to me. They said if we had known better, you know, then, you know, obviously we wouldn't have done this. But at the time you were born, everybody was doing it. And so, you know, I accepted that, and I've moved on from it, and they regret it, and I regret it. But, you know, you can't change the past.
Well, you know, that's another thing that we feel that, you know, not only are the people, the babies that are cut and the men that they become, not only are they victims, but the parents are victims of this as well, because they really don't know what they're doing.
And how much it's pushed upon them.
Yes, they don't understand like the harm that's going to come from it. They believe it's going to be beneficial, and they're afraid of you not fitting in with your peers. All of these reasons that that have really changed over the years, and so we really think that parents are victims of this too, because it really is pushed on them, and they do want to do what's best, and they feel they're very afraid of not doing it since it is such a common thing in the U.S.
And how do you get religious people behind this movement? Because I know for some religions like Islam and Judaism that this is a very common thing.
Well, you know, that's a good question. It's not so easy, because many people are very committed to their religious beliefs, whether they're the Jewish faith or the Muslim faith. But there are some people of the Jewish faith that are practicing an alternate ceremony. Instead of a bris, it's called a bris shalom. And it's a slightly different ceremony with the baby, and it doesn't involve cutting baby's genitals. But you have to understand that religious circumcisions are a very small percentage of the circumcisions done in America. Most of them are done by doctors. Like the vast majority, over 90%, are done by doctors in hospitals for cultural or quasi-medical benefits or misbeliefs, or just because the parents just want it. That's where the bulk is, and that's what we focus on in our advocacy, is the medical circumcisions being done.
But a lot of people in the movement against circumcision are Jewish. There are lots of them that are in it. They feel that this is another tradition that needs to just be rid of. Because at one time in the Jewish religion there was plural marriage for men, there was owning slaves, there were all these other things that at the time it was the thing to do. You know, there was nothing wrong with it whatsoever. It wasn't considered, it was just day-to-day business. So they feel that circumcision is just another one of those things that needs to go the way of plural marriage and owning slaves and you know, putting your wife in the backyard when she has her period. So yeah, they are very just like other human rights issues in the U.S. They are right there in the front of it, and we have plenty of members in Intaction that are Jewish that are out there, you know, advocating with us, and it does help Jewish people that are coming up to us. A lot of times they, you know, they don't really want to. They don't want to feel that we're preaching to them about their religion. We're not part of it. So it does help them to talk to another Jewish person about it that can really, you know, has had that same experience of them growing up and going to all these bris ceremonies where they see it done, and you know, and a lot of Jewish people really come up to us because they've wanted to talk about it. They've seen like these babies screaming over and over again, and but you know, like, what can I do? I'm Jewish, you know. So you know, we let them know that over 300 rabbis in the U.S. alone are offering this ceremony called the Brit Shalom. And that it, you know, they cut a pomegranate or they cut a ribbon, whatever that signifies that, and they name the baby as it is a naming ceremony.
Great. I'm glad that those religions are evolving with the times, and you know, with more information and more advocacy. I hope that they continue to push like more people to be aware about this. On your website, it says that some of your past events have included disruptive protests and demonstrations. Can you tell us about those?
We did a disruptive protest of the Clinton Foundation event at the Brooklyn Hall of Music, I think it was, a while back. And this was a few years ago, but you know, the Clinton Foundation was one of these foundations like the Gates Foundation now giving money to promote circumcision in Africa and taking advantage. You know, I think they're well intentioned perhaps, but you know, they push their donors for money under the guise that they're doing something good. They're actually harming people. You know, what they do is they give money to poor people in Africa to act as like recruiters to go out and try to round up young men to be circumcised, and they pay him a commission for every guy that they can get into the clinic to be circumcised.
Why do they want to do this? Like, what is in the benefit for?
They believe they're stopping HIV, and you know, based on those flawed studies that we spoke about. So we did disrupt the Clinton Foundation event. We stopped them from speaking.
Do people get confused? Because when you hear it and you're there and you say, we're trying to stop HIV in Africa, and these people are here protesting us trying to stop HIV in Africa, it sounds like you guys are the bad guys. Like,
well, we had a chant, didn't we?
We said condoms, not cutting. Was one of our chants. Right,
and we said, stop exploiting Africans. Circumcision does not stop HIV. So we chanted, we got up and we chanted, Anthony blew a whistle first, which, you know, scared the living hell out of a lot of people. And I was like, are you sure you want to blow that whistle? And he's like, oh yeah, we got to blow the whistle. So he blew the whistle. We got up and we put our hands together and we said, stop exploiting Africans. Circumcision does not stop HIV. And we just said that over and over again, and you know, there were people getting out the way, and there were, but you know, they and you know, we got some, you know, serious jeers from people, and Bill on stage, he was like, well, I'll tell you what it does do, it stops HIV by 60%.
That's a great Bill Clinton impression.
And that's when we went into like condoms not cutting, condoms not cutting. And then Chelsea said, well, I don't understand why they're mutually exclusive.
So they actually acknowledged that you were...
we were kind of having a discussion back.
Oh, that's amazing.
They had no choice. And we were doing that audience a big favor because he was just carrying on about himself. There was an actor up there talking about how amazing Bill Clinton was. Bill Clinton was like, I have done more than any a president after they were president in history. And he was just talking about himself. And at first I was feeling bad that we were going to be disrupting this. And I'm like, please, we got to wake people up. But afterwards, they escorted us out. And
the Secret Service did.
The Secret Service, there was a slow chase where the Secret Service came after us, and they caught up with us, and they said, well, I have to ask you this. Why are you here, and whatever. So we have to do this with anyone that does. But first of all, I want to thank you for doing like the best protest that anyone ever has. You didn't throw things at the stage. You didn't whatever. So I want to thank you for being so peaceful and not giving us a hard time.
But you gotta get out, is what they're. Well, that's respectable. You guys did it in a very peaceful way, it seems, and it got their attention. Right. There was no way that it couldn't.
And when you do a protest, there's the point of getting your message out, but not to the point where you start turning people off to your message.
Of course, yeah. That's what I thought. Because was there anybody that was like, "Hey, I would like more information"?
No, I don't think we got to that point.
Not there. They wanted us out of the way.
As long as you're getting out there and you're trying to get people informed, that's what matters. That's really awesome. And
there were like 2 press releases and there was a story or 2 on it, so it got out there, for people to access more information afterwards. So
that's great. Do you find that the media is caring more about this?
They are now. At our last Union Square thing we did this Tuesday, we had so many people coming up to us that knew a lot of facts about the issue already. This is so different than 1 year ago. There might be one person every blue moon that came up to us that had some understanding, that knew about the Kellogg's factor, that he brought this to the U.S.
What is that?
Kellogg's cereal. He brought this to the U.S. as a way to stop masturbation, because at the time, masturbation, this was like 1890. And he published a book on it that was very, very popular at the time, and they felt that masturbation was the cause of so many problems. It was the cause of that having an orgasm depleted you of like 10% of your body's energy and blood and all this, and you had to recoup from that. So to stop babies from doing this, they made the temptation less by cutting off the foreskin. And he also said that with girls you should put some boric acid or some kind of acid on the clitoris so that they have a painful memory of this and they stay away from doing that too. But he really felt it was a great deterrent to stop boys from masturbating. But and the fact is, it does cause a learning curve, because many boys do not understand that without foreskin that they have to use some form of lubricant, spit at the very least, in order to masturbate without it hurting, without and being able to do it frequently. But having a foreskin there there's lubrication. It self-lubricates just like the vagina does when it gets sexually stimulated. So and having that skin there, the proper amount of skin to go back and forth, it makes it better, and it also stops.
They'll never know the wonders of like how much it feels better because of the nerves there, right?
There's 20,000 nerve endings in the foreskin. It's look, you can't. Circumcision alters the form. You can't alter form without altering function. So if you're taking something away, that's not. It's going to decrease what nature intended it to do.
But one thing is, gay men really find this out in their sexual experiences. If they run into a lot of intact men, they suddenly realize, like, wait a minute, you don't have to use lube to masturbate. You don't have to, and sometimes they'll then notice when they're with another cut man that it's almost a spitting contest, to spit and grab and spit and go and spit. Everything requires requires all this thing. Whereas with an intact, natural, whole penis, you don't have to have all this extra stuff, and the sensation there just makes it so much better that there's so many benefits to it.
You know what's interesting? I saw one of the reasons pro circumcision was that because men have more nerves in their foreskin, they feel more, which actually will make them come faster. So the reason was that women actually prefer men that are circumcised because they'll last longer because they don't feel as much, so that actually makes them happier.
Yeah, actually it's the opposite, you see, because when your penis is intact, you have more control. Or, you know, all those nerve endings, you can feel more, but they give you more definition, and they give you a better sense of where you are on the continuum, on the curve before you reach orgasm. Okay, so with a circumcised guy, he may have to thrust very hard or pound a lot, and then it happens too fast because he can't control what's going on. His nerves have been severed, and what's remaining after the circumcision, the nerve endings have tried to reconnect themselves the best that they could, and they're usually mismatched and misfiring. So circumcised guys can have more problems with premature ejaculation. But going back to the media part of your question, you know, when I first started this, I've been doing this over 10 years now, being an activist. And we used to go months and months and maybe even a year before we'd see an article in the newspaper about circumcision. You know, now it's like every week there's an article in the media, press, radio, TV about circumcision, about foreskin, about FGM and male circumcision. Is just an ongoing stream of information. So much as even as an activist, I have a hard time keeping up with everything because people ask me questions and I'm trying to remember everything. So there's just a really heightened public interest on this issue like we've never seen before. Public attitudes are shifting based on surveys that both we've done and online surveys like YouGov showing young people don't support this. Attitudes are changing, and we're getting closer and closer to the tipping point where society flips and they start having a negative view of circumcision.
And the coverage is being more and more positive towards foreskin, which is totally the opposite of the way even 2 years ago or even a year ago, every article had to have the AAP comment in it. It had to have CDC in it. All these things that oh no, there are medical benefits to it and all this. But now there are articles that are just like foreskin is a fantastic thing. It's about how women are learning to enjoy sex better. They're learning that intact men don't have to pound and pound and pound away. They don't come away as sore from sex. That they don't have to work as hard when it comes to like masturbating a guy. Oral sex. They can just kind of enjoy it. It's much more of a sensual experience. Whereas with cut men, you got to work that stuff. You got to work that really hard, fast and tight. So it's a different sexual experience, and it's just a better sexual experience when you have more options.
In these media interviews, you rarely even see them, the reporters, the journalists, or the radio hosts, even talking to a doctor. They don't even want to talk to the doctors because the doctors have lost credibility on the issue of circumcision. They'll talk to us. They'll talk to activists like ourselves.
They really care.
I do about 2 interviews a month, and it's always just been me and the host and me and the journalist. Doctors aren't even included in the conversation anymore because they don't have the credibility on the issue.
Do you guys ever find it uncomfortable or weird to if you're at a social setting to come into the conversation and be like, hey, did you guys hear about this circumcision versus not circumcision stuff? Intact? Is it ever weird to just bring up, penis in any situation?
Not for us. Look, if you're an activist, you're comfortable talking about penis, vagina, masturbation, sex, oral job, blowjobs, anal sex. We talk about it all.
Hey.
So, and when we're at our events in Union Square, people give it all to us. So there's no reason to be bashful over this. This is our bodies were designed to have foreskin. It's in our DNA. Females have foreskin too, in the form of clitoral hood. It's the anatomical equivalent. We all have this. We all have sex. So there's no point in being embarrassed about talking about this. And I think most people aren't. You know, today with social media and Twitter and Instagram, people are posting pictures of everything. We have very little expectation of privacy, so we might as well talk about it and be honest about it. And that's the world we live in now.
And as you'll see, like on everything we do, like the word foreskin is all over it, all over it. Foreskin, foreskin, foreskin. Because we, you know, it's one of those things like lesbian in, you know, the 80s and the 70s. It was a dirty word. You know, when you say lesbian, it was like meant this kind of sex thing that, you know, was, you know, it wasn't like. Even lesbians would use the word gay instead of lesbian because lesbian had this connotation to it. So, but the more and more you get the word lesbian out there, the more you understand it's just, hey, it's just absolute natural and normal and great and all this. So we do the same thing with foreskin. We make sure the word foreskin is really in your face. We as I like to say, we shove foreskin down your throat.
Amazing. I love that you guys are trying to make it no longer taboo. That's one of the big things about this podcast is I wanted to reimagine what society considers normal. And yeah, circumcision is considered normal for so many people, especially in the United States. So I'm glad that I got to have you both here. Can you both let the listeners know your names and then where they can find Intaction?
Anthony Losquadro. And we're at Intaction.org, INTACTION.org. Visit our website, check us out. If you believe in foreskin as much as we do, then come along, come to our website, support us. We're all privately funded. We're unpaid volunteers. And our board of directors and staff are all unpaid volunteers. We need people like who believe in this, what we're talking about, to support us and help us and get the word out. We're about educational advocacy. We're not forcing our ideas down anybody's throats, but we think that if we can give Americans this information that we have and the things that we've learned, and we can share this with other people, we believe they too will come along with us and try to keep babies, girls, and boys intact in America.
And I'm David Grant, and part of Intaction.org, and yeah, we are against male, female, and intersex surgeries. These are all completely unnecessary. Completely unnecessary. It can be done later in life to the total satisfaction of the person that it affects most. And that's another thing. Like intersex right now is a big, you know, topic, and they're you know, moving it so that you should not do this to a child. You shouldn't assign a surgery to them and assign a sex to them via surgery. Let them grow up and make their own decision about it, because they're quite depressed about it, and some commit suicide later on that this was forced upon them. This is the same issue as circumcision and you know, one's foreskin. So, you know, if you believe in you know, people having independence and letting people be themselves and who they are, then letting them have all of their genitals is completely important.
Quick question that I just thought of. Are you guys looking for an all-out ban on circumcision, or are you looking for more advocacy and education so that people make the choice themselves, maybe when they're later on in their own lives?
We honestly believe that if people know the facts, know the honest, real facts about foreskin, that they won't do this to their children. If they see the examples that we provide, if they know about the horrible complications that can happen, if they know that so many men are completely unhappy that this was done to them, if they know about these things, they won't do it to their kids. As far as bans, we're not after that. You know, we believe that it's absolutely wrong, 100% wrong to do it to your child. But bans, you know, they're just going to make the issue so much more fierce, and there's going to be all sorts of fights about you know, religious freedom and
First
all
Amendment
of this.
issues.
Yeah. So we really believe that education is the answer.
Amazing. Well, thank you both for coming on. This is a great interview, and I'm glad, and I hope people get out there, and I hope they support. I hope they at least get educated about it and then make the decision themselves. And when it's time for them to be in that room with the doctor when their child was just born, they make an informed decision about this. So thank you for educating people about this and for coming on the show.
Thanks for having us on.
Thank you.
Hey.
And I might say that that there needs to be no decision. As with most of the world, 80% of the world, they make no decision about their penis. They don't have to. It's just natural. Leave it there.
Hey.
All right.
Nice.